Effectiveness and adverse events of endoscopic clipping versus band ligation for colonic diverticular hemorrhage, a large-scale multicenter cohort study. Introduction. The most common cause of acute lower gastrointestinal bleeding is colonic diverticular hemorrhage, CDH. Given that CDH with stigmata of recent hemorrhage, SRH, treated conservatively has a high 30-day rebleeding rate of 65.8%, endoscopic treatment is indicated for definitive CDH with SRH. Several endoscopic treatment techniques for CDH have been reported, including epinephrine injection, contact thermal therapy, endoscopic clipping, endoscopic band ligation, EBL, endoscopic detachable snare ligation, and over-the-scope clipping. Among these, endoscopic clipping is the most common because of its simplicity and low invasiveness, and is the most frequently performed technique in Japan. EBL is, however, becoming more widely performed because it allows for occlusion of SRH and any underlying arteries. Although a recent meta-analysis reported lower early and late rebleeding rates with EBL compared with clipping, the number of cases in each study included in the analysis was small, with at most 101 cases per treatment method and only 790 cases analyzed in total. In addition, these were all single-center studies, so their results may suffer from bias in relation to the treatment strategies and techniques used in each study setting. Importantly, relatively few of the studies investigated the long-term effectiveness of the various endoscopic treatments for CDH, and the rates of diverticulitis and perforation, which have been reported as adverse events, AE, of endoscopic treatment for CDH, could not be confirmed by the systematic review because of the small number of cases analyzed. To address these issues, the authors conducted a multicenter, long-term cohort study in Japan and report here the short and long-term effectiveness of clipping versus EBL for CDH, as well as the AEs associated with them. Methods. Kobayashi et al. Reviewed data for 1,679 patients with CDH, of whom 638 were treated with EBL and 1,041 were treated with clipping between January 2010 and December 2019 at 49 hospitals across Japan in the so-called Code Blue J study. Logistic regression analysis was used to compare outcomes between the two treatments. Results. In multivariate analysis, EBL was independently associated with reduced risk of early rebleeding and late rebleeding compared with clipping. These significantly lower rebleeding rates with EBL were evident regardless of active bleeding or early colonoscopy. No significant differences were found between the treatments in the rates of initial hemostasis or mortality. Compared with clipping, EBL independently reduced the risk of needing interventional radiology and prolonged length of hospital stay, but not need for surgery. Diverticulitis developed in one patient equaling to 0.16% following EBL and 2 patients equaling to 0.19% following clipping. Perforation occurred in 2 patients equaling to 0.31% following EBL and none following clipping. Conclusions. Analysis of the author's large endoscopy dataset suggests that EBL is an effective and safe endoscopic therapy for CDH, offering the advantages of lower early and late rebleeding rates, reduced need for interventional radiology, and shorter length of hospital stay.